Welcome to What's Now. This is a show where we find out what everyone's talking about and give you important information that you want to know about. I'm your host, Christine Napier. Thank you for joining us on our show today. It's a busy episode full of talking about your health, also vacationing, Airbnb, and so much more. Up first, your health, though. What is happening right now with research with lung cancer? Well, we have an update on information that you don't want to miss. Let's take a look.
Lung cancer survival rates are on the rise in the U.S. as scientific breakthroughs have advanced treatment for people with lung cancer. However, some people living with the most common type of lung cancer, called non-small cell lung cancer, do not receive testing that helps identify characteristics about their unique cancer and informs treatment decisions. A new campaign hopes to educate the public about biomarker testing. If you're living with non-small cell lung cancer, one conversation with your doctor could make a difference in your treatment. Here to explain is Dr. Jorge Gomez, a medical oncologist in the thoracic oncology program at Mount Sinai Hospital in New York, and Andrea Ferris, President and CEO of LUNGevity Foundation. Thank you both of you for being here.
Thank you for having us.
Dr. Gomez, tell us about these new survival rates in lung cancer and why they are on the rise.
The survival of lung cancer had improved very slowly since the early 1990s, but in the past few years, from 2014 to 2018, the improvement in survival accelerated. And so more recently, the survival has been much, much better for patients with non-small cell lung cancer.
And Dr. Gomez, what is comprehensive biomarker testing and what should lung cancer patients know about it?
Comprehensive biomarker testing is a way for us to look at each patient's tumor and try to figure out whether it has genetic changes or drivers that can help us figure out what the best treatment for that patient might be. There are different types of drivers. There are mutations. There are molecules on the surface of cancer cells. And these help us decide whether a patient should receive chemotherapies or targeted therapies or immunotherapy, some of the newer treatments for lung cancer. Now, the comprehensive testing looks at many different biomarkers that currently exist for which we have drugs, and so it really should include all of those. So it's important for all lung cancer patients to talk to their doctors, to ask their doctors if comprehensive biomarker testing has been performed and whether or not there is a biomarker that can help in terms of treatment. It is going to be the most important decision that a patient with lung cancer makes. What is the first treatment? Because that first treatment will usually or typically be the best treatment.
Andrea, tell us about the latest campaign to raise awareness about this important testing.
Yes, thank you for asking. At LUNGevity Foundation, we strongly believe that all people diagnosed with lung cancer should have access to optimal care. And as you've heard, in non-small cell lung cancer particularly, it's hugely important that they get comprehensive biomarker testing to help to inform their treatment options, which are personalized to them. It truly is personalized medicine. And so what we did is we created and launched this campaign called No One Missed to really educate and inform about the importance of comprehensive biomarker testing. And the goals of the campaign are exactly as the name suggests. Our goal is to ensure that no one who is diagnosed with non-small cell lung cancer is missed when it comes to comprehensive biomarker testing. It shouldn't matter where you live or what you look like or what language you speak or what type of doctor or clinic you go to with respect to receiving optimal care and lung cancer and the optimal treatments. And that very first step that can help you make the most informed and important decision is having the comprehensive biomarker testing done.
Dr. Gomez, how does comprehensive biomarker testing help inform treatment options for lung cancer patients?
Comprehensive biomarker testing can help us in several different ways. First, it can potentially predict what patients are very likely to respond to certain drugs. So what patients will respond to targeted therapies and what patients will respond to immunotherapy. So it really helps individualize the treatment of lung cancer for that specific patient.
Andrea, where can people go to learn more about biomarker testing in lung cancer?
Yes, to learn more about biomarker testing in lung cancer, I strongly encourage people to visit the no1missed.org website. There, they'll find a lot of great information as well as downloadable materials, questions to ask their doctor, how to interpret a test results report, and also just more information about what a biomarker is in general. The other place to go for more information is the LUNGevity.org website. And there'll be more in-depth information as well as resources to help a person navigate their lung cancer diagnosis and disease.
Well, thank you so much, Andrea Ferris and Dr. Gomez, for joining us today on Proxy Television, this important information about lung cancer and comprehensive biomarker testing.
Thank you for having us.
Thank you.